afternoon. Welcome, everyone, and thank you all for joining us this afternoon. My name is Erica Lindemood, for those of you who don't know me, and I'm the Director of Public and Community Programs at Revolutionary Spaces, which is a new organization in Boston that was formed by the merger of the Bostonian Society and the Old South Association just this January. Through a wide range of dynamic programs and community partnerships, we bring people together to explore the history and continuing work of democracy that is singularly evoked by the two buildings that we care for, the Old State House and the Old South Meeting House. Over the past 2 months, our team has been working diligently and swiftly to move our programming and fundraising efforts into the virtual world so that we can continue to carry out our mission while adhering to physical distancing guidelines. The Revolutionary Spaces team will continue to launch conversations and virtual events like today's, so please stay on the lookout for email invitations and social media posts for future events. Before beginning today's program, we would like to acknowledge that the land that the Old State House and the Old South Meeting House stand upon is the occupied homeland of the Massachusetts people. We honor and respect the many Native peoples who are connected to this place, past, present, and future. This afternoon's program is the second event in what we hope will be an ongoing partnership with the Black Caucus of Health Workers. If you missed the first of these conversations on April 30th, you can find it on the Revolutionary Spaces website. Today's conversation will also be recorded so that it can be accessed and referred to moving forward. Today's conversation will pick up on some of the issues raised during the last panel discussion, namely, how can storytelling and the arts inform public health policy and action? Toward the end of that discussion, Revolutionary Spaces board member and public health expert Asaf Bitton responded to a question from the audience about building community resilience and more just and equitable public health outcomes in the wake of the current pandemic and beyond. We have the data, he said. We need artists, historians, and others in the arts and humanities fields to share these stories in ways that help to drive the change. We're excited to have a dynamic group of panelists gathered here with us today with experience here in Boston, across the country, and around the globe to reflect on the question of driving change through storytelling and the arts during this critical moment. And now I'm pleased to introduce our moderator. Eram Alam is an assistant professor in the history of medicine at Harvard University with a focus on globalization, migration, and health during the 20th century. Eram received her PhD in history and sociology of science from the University of Pennsylvania. And now I'm pleased to turn it over to Eram.
All right, thank you so much, Erica. I'm really excited to be able to moderate this conversation because I think it's an aspect of this current pandemic that we haven't actually given enough attention to, which is how are the arts going to inform the ways that we think and experience and feel this current moment. So I'm very, very excited to introduce our 4 panelists today. First, we have Marian Taylor Brown, who's the founder of the Boston-based nonprofits Arts Connect International, which focuses on building equity in and through the arts, and is a lecturer in the Honors College at UMass Boston. I should say Dr. Marian Taylor Brown, who just received her PhD, right? She earned her PhD from the School for Global Inclusion and Social Development at UMass Boston. Next, we have Shanae Burch, who is a digital and performance storyteller with passions for health literacy and activism, and a Black Caucus of Health Workers board member. She received her Master's of Ed in Arts and Education from Harvard Graduate School of Education in May 2016, and began pursuing a doctorate in health education at Teachers College, Columbia University in 2017. Next, we have Clare Dowd, who is the founding executive director of Creative Action Institute. With over 20 years of international experience, Clare has worked with hundreds of international and grassroots partners across Central America and Africa to design programs that leverage creative methodologies to advance women's and girls' equality and build resiliency in the face of climate change. Clare holds a bachelor's in English literature from St. Michael's College and an MBA in international business from the University of San Francisco. And finally, we have Cara Solomon, who's the founder and executive director of Everyday Boston, a nonprofit that connects neighbors across the dividing lines of the city through the sharing of stories. A graduate of the University of Michigan and Columbia University Graduate School of Journalism, Cara continues to work as a freelance journalist. So to set up this conversation, we're going to take a moment to think about and listen to a poem by Ross Gay called A Small Needful Fact. And this is a reflection on Eric Garner, which I think is especially important in this moment where we've just endured George Floyd's murder. So we're ready for them.
Small needful fact is that Eric Garner worked for some time for the Parks and Rec Horticultural Department, which means perhaps that with his very large hands, perhaps, in all likelihood, he put gently into the earth some plants which, most likely, some of them, in all likelihood, continue to grow, continue to do what such plants do, like house and feed small and necessary creatures, like being pleasant to touch and smell, like converting sunlight to food, like making it easier for us to breathe. Small, needful fact is that Eric Garner worked for some time for the Parks and Rec Horticultural Department, which means perhaps that with his very large hands, perhaps, in all likelihood, he put gently into the earth some plants which, most likely, some of them, in all likelihood, continue to grow, continue to do what such plants do, like house and feed small and necessary creatures, like being pleasant to touch and smell, like converting sunlight into food, like making it easier for us to breathe.
The question that Ross Gay really poses to all of us is, how do we think about life in the face of death? And right now, the death that we're experiencing is COVID related. So how do the arts and the culture come into this kind of conversation? So we'll start off with this general question about what can arts and culture do for public health, and what exactly is the conception of the public and of the health of the public that you think about in your work? And I'll open it up to anybody to start.
So I'll start. So when I think about public health, I'm working under a general definition that the American Public Health Association states as their mission, and being concerned for the health of the public and thinking about achieving equity and health status. When I think about the arts and culture, and I think about the global landscape of that and how the arts can, provide direct health benefits, but also how the arts can facilitate dialogue and engage community, engage participation for like community mobilization. I then think about how, when we think about public health, we really are talking about global health and how the health of individuals, communities, nations are interconnected with one another. And so that's what I think about when I think about arts and culture and what it can do for public health.
I'll go next. I was thinking when I was listening to the poem, just how art has that power to evoke a sense of profoundness that touches you at a heart level, to really think about the contribution of each and every life. So as we look in the face of death and in the threats before us, how that can happen. But I think, as Shanae was saying, that our art really has that power to, unite across difference, to build empathy, to heal and support behavior change, really, and to challenge power structures. And I think that when we look at public health, Creative Action Institute is working in the international development context in Africa and Central and South America. And you see how the need in terms of public health, where advocacy it doesn't work without cracking open that heart space. So the art's role in being able to build that empathy and understanding and being able to engage partners as allies in the process of creating the change is critical. And there aren't enough mechanisms for that. So the arts really play a really critical role, in my opinion, in helping to bring that about.
Thank you, Shanae and Claire. I echo the sentiments, particularly around heart and the interconnected nature of our globalized world, which is more apparent now than perhaps ever before, a really positive and affirming reminder of how incredibly important we all are to one another when it comes to upholding public health and equity within that space. And my entry point into public health was I grew up in a very public health oriented family. So I was an artist from an early age. I was a visual artist and creator. And as a student who grew up with significant learning disabilities, art was a really important tool for me to both access and express curriculum. And I think that experience has transferred throughout my career in looking at how within public health spaces, similar to inclusive education, how can we utilize arts and culture and arts and community to leverage the educational outcomes that we're looking to achieve? And my work directly has been in HIV and AIDS and post-traumatic stress disorder, PTSD with veterans, a lot around paper making, theater for development in these different spaces, as well as Alzheimer's and community care and related dementias. And now more focally within racism and institutionalized and systemic oppression, and how those aspects of society and community deeply affect our health determinants. So when I think of my position as an artist working within public health, it's impossible to divorce the interconnected nature of our health outcomes and actualizing what it means to move towards equity. And the arts are a really beautiful and supportive tool in doing that work, and a really essential partner in really honoring and valuing and centering community in that process, as well as healing. Can you unmute?
There we go. Okay, apologies. Yeah, I think that the way that I and Everyday Boston thinks about health is more around a sense of belonging and the health benefits around feeling like you belong and feeling like you're seen and feeling like you're heard. So I think that, I've always just thought of stories as kind of the gateway drug to human connection. I think they're kind of like the quickest kind of shortcut. And so we are trying to use that as a tool to, number one, connect people and to shift sort of the culture out there a little bit, story by story, neighbor by neighbor, to a culture that is all about curiosity and connection. Because we know that, everyone on this call knows, right, that the more we make everyone visible and the more we sort of reach out to connect to one another, it has just far-reaching impacts in all corners of society, including in community police relations and in the health, in healthcare. So that's what I would say.
That actually leads perfectly into, well, I don't want to interrupt anybody, but the next question, which is about the ways that you actually use narrative or storytelling to do this kind of work, how you make the connections between people. So maybe we can just go with Cara there to give us some examples and then open it up.
Yeah. So my shift was a little bit, it's interesting because I used to work in a newsroom and did storytelling sort of on behalf of the community. I think that's kind of how journalists almost see themselves and the media sees themselves. And now this work is very much in partnership with people, with the community. And I am, we are partnered together in not only trying to get stories out there, but to build community while we're doing so. So, just very briefly during COVID, what we've done is we pivoted to remote story collecting projects. And those projects are designed to ease social isolation between neighbors and also really amplify critical voices. So One of them is called the Essential People Project. So that's neighbor to neighbor interviews with essential workers who, of course, have always been essential. And now they're putting their lives on the line. And the second one, again, gets to this really core issue of loneliness, which is connecting elders in our community with younger Bostonians for recorded phone conversations about life and about how they got through. So again, essentially we're trying to build community using technology no longer as the enemy as I saw it previously, since we very much relied on the in-person connection, but now we're actively using it for good, one hopes.
So if I can just to understand what you're asking is examples of how we've been using arts-based processes or storytelling right now in response to COVID or in general?
Either.
Okay. So we have been using a wide variety of art modalities to address a lot of public health issues, but also gender equality, which to us is part of the public health spectrum. And also a lot of environmental issues. And I think that an example of where we have, our goal is to make sure that the solutions are developed by the people who are experiencing the problem. So we are trying to equip communities with creative methodologies that can help them arrive at the solutions that make sense for their context. So, we started out as a sort of a Peace Corps for artists, sending artists out into the field to work with organizations to help promote their messages. But we've shifted and we've backed up because we shouldn't be at the forefront. Let's put whoever's living in those communities at the front. And we've shifted to a train the trainer. So we've been equipping non-artists to use creative methodologies to lead efforts at the community level to deconstruct problems and build solutions. So this is an example of that is we bring together the East African Girls Leadership Network, and it's women and girls from 5 countries in the region who are living in some of the most marginalized areas. And we are providing deep training and coaching over a few years to help support them in challenging the social norms that are entrenched and standing in the way of girls accessing their human rights, to health, sexual and reproductive health services, and all of these elements, including in education, and to stand up for a wide variety of things. And equipping them with strategies to take the arts into community for dialogue, reflection, exchange, community building, understanding. An example would be when one of our mentors working with a group of a couple of schools of girls in the Maasai area of Kenya and Iraq was able to work with the girls to develop poetry, dance, storytelling, and song for them to do a whole series of performances over a few days that brought together the whole community. And when you think of, it's the law in Kenya that female genital mutilation is illegal, but no one enforces it because the grandmothers get the money. That's like a livelihood issue. It's a coming of age right. There are all these issues and reasons why it's ignored, the law. But so you need to get in there at the one-on-one, the individual level. So bringing the community together for these performances and using a process to deconstruct it with them. So teaching the girls and the mentors how to be able to engage in a dialogue that lets people reflect and look at the issues. So they were able to do what art does, which is crack open the heart and build the empathy and understanding. And then together as a community to come up with what are our steps to stop this practice, and let us all pledge here that we won't do it anymore and our girls won't have it. So you can apply that to many, many issues. And I would say that for us, we have seen the power of so many different art modalities to be able to do that, to reflect a reality back to create understanding and open a space for change and action. I'll leave it there.
I'll offer that in my bio, and I think in my first initial answer, I had referenced the American Public Health Association and my affiliation with the Black Caucus of Health Workers. And so we are the oldest caucus within this professional association. And we are united in our identity and as identifying as Black health professionals. And we've found that storytelling through this oral history project that we've been working on for the last few years, is critical, not only in facilitating, storytelling in our, everyday work, but also for our organization's memory and preserving our understanding that our work is important because the communities that we serve are incredibly important. As a theater maker who's found my way within the profession of public health, I've always found it a delight when theaters insert in their artistic direction a commitment to health, whether the direct plot of the story is, you should brush your teeth, like it is not necessarily the aim, but most recently a theater performance I was a part of at the Lyric Stage Company in Boston had to be cut short. It's called The Treasure by Max Posner, and it followed a son struggling to love his mom, living with a memory disorder, dementia. And this piece was a dark comedy. It was both funny, but it was also incredibly heartfelt and deep, and had dark moments. And so when I think about how storytelling and narratives can be a part of our everyday work, I think about the nuance that artists and cultural bearers can create, but then also as theater makers, but then I also think about how we can use that work to enhance and improve our organization's integrity and to celebrate traditions, and also break off from things that maybe we do just because we've always done, as opposed to connected to our mission or our values.
When thinking about this core piece of arts as storytelling and storytelling as art, I think for Arts Connect International, our locus of change has always been the artists themselves. And that's taken a really community contextualized stance where we're working with artists who are already using their work for social change, that are invested in these intersectional justice questions, which inevitably have touch points with public health. So what I've learned as an ally and as a support within this space, particularly around racial equity, a lot of my learning has been around what does it look like to support in building platforms for this work to be heard. Because these stories are not necessarily stories that are untold, right? They're actually told in abundance, but they're often unheard. And when we think from a public health perspective of the role of narratives in changing behavior in particular, I think it's the deepening of listening to one another. And with that, trusting that artists across all disciplines and across all different foci are able to bring their whole and authentic selves into the spaces that they're occupying through their culturally relevant art forms. And I've also been on the other side of organizing too, where we're using art directly to address public health issues, which also has its merit and it has its value for self. The work of showing up and trusting artists to be the ones that steward that dialogue and that message has, for me, been the most important and impactful. And as I think about the future of how we can continue to build the intersection of art and public health, I think that's the richness that we can really tap into. And I think it's where the work is already inevitably happening. A lot of what happens, at least in a pandemic moment, is this question of crisis becomes kind of the framework for thinking through things, emergency, and arts are seen as something that are not related to this kind of crisis moment. So I would invite you to reflect on this question of how have you thought about this current pandemic, COVID-19, in relation to arts and culture?
I'll jump in. So, we come at it from a little bit of a different perspective because our core focus is around the gender equality and the sustainable planet work, but it's our way to get there is through the arts. So in the spaces where we're working, in the countries where we're working, COVID has presented a real shift for us because we're all about bringing people together. And all of our work, it's around coming together and using these participatory processes to really work through ideas together and do some solution building and do community art, like bringing in stakeholders from the old to the young, indigenous, every part of the community together. So this is now, we're all separate. So what role does the arts have in this, and how can we draw on it? So we've had to really dig deep. And so we reached out to all of our partners and we listened to them to hear what would be of value and how they wanted to work with us in that space. And so we've moved a lot of our core training, skill development, skill building, knowledge building online. But then around the advocacy work, we thought this is a real opportunity with all the girls are in their individual villages and not at the schools. How can we set this up? So we have our mentors creating these safety circles with the girls, and they are working with them with using the social distancing to develop radio dramas, because now, no one has internet access at the village level. So even the technology that we resisted before is working for us in some capacity, but it's not in our most remote areas. So we're using SMS-based prompts and learning to facilitate individual growth and using art processes. We are getting materials out in safe ways for them to access. And then the girls are creating radio dramas that are reflecting the challenges that are coming up around safety, around gender-based violence, around sexual and reproductive health, what's happening as a result of COVID. Those radio dramas are being recorded in a way so they can have the distancing, but it's still possible to do, and then broadcast out. So knowing that people want to tune in and connect to something, these are an avenue for so many more people. We'll be reaching many, many more than we were before. And so that's kind of an exciting step. But we thought, it's so interesting. When you're pushed to this point where everything doesn't make sense anymore, how resourceful you can be. And that's where creativity comes alive, and the arts can play a huge role in helping to bridge it, because a lot of the activities we are bringing the girls through in the SMS-based learning components are around their own self-care. It's around their own reflection, understanding. How do they stay in the game? When Ebola happened, there were all kinds of studies post that, like who was the most vulnerable and not returning to school? And of course it was girls. So they got married off, or they became pregnant, or whatever, all the endless list of barriers were perpetuated and made even worse. So finding a way to keep them in the game and keep them engaged and keep them feeling connected to each other through artistic expression has really been for us a big light bulb, and something we'll continue, doing in this format that we've been pushed to expand our thinking around. So it's been quite a dynamic time, really.
Part of the question that is holding with me is this aspect of the devaluation of the arts in this moment. And what is striking for me in this moment is the clear articulation of structural inequities that are being perpetuated both within our health systems, and I'm thinking very much in the context of Boston in this moment and how I'm speaking about this, and then that's being reverberated within the arts and culture sector. So a lot of the systems that we have become dependent upon, like we're looking at a national loss in the arts and culture sector of over 5.8 billion at this point, and in Massachusetts, 55 million in revenue generation alone. So if you think about what it's going to mean to have accessible arts and resources, there's both this immediacy of the response within this moment, but then there's also the long-term care and the long-term reconceptualization of how we're propagating value within the arts and culture sector. And I think this is a really important opportunity to challenge some of the hegemonic norms around certain art forms that have been prioritized for a long time. I think it's a really important time to look at donorship models and how incredibly broken the nonprofit sector can be in that space, which is primarily where the arts live. And it is a moment in time too of pause where you think in Boston, our number one revenue generator is higher ed, and then it's public health and health institutions, and then it's our arts and culture sector. So there has to also be a correlation of one succeeding with the other. And I think what we're seeing here can be replicated and is seen nationally as well as internationally too, depending on whether you're participating within the political economy of the arts and whether there's more of that economic or cultural valuation to the art form itself. So there's certainly a redistribution of understanding in this moment of what does it mean to do these things in a virtual context? What does it mean to distribute school supplies? What does it mean to have this be a way of promoting health and support in the most cost-effective measures? What is the role of TikTok? Sorry, going to go there, but what are our virtual platforms if that is accessible? How are we utilizing those spaces and forms? But also what is healing across both spaces? And if you look at the structural inequities again in our public health system and who's getting impacted most directly by COVID, and that being communities of color predominantly, that's not dissimilar to what we're seeing. So I guess my optimism within that too is the fact that this gives time and hopefully pause and reflection for radically changing the system as we know it and organizing in a different way and prioritizing in a different way. And I hope that this response that the sector is also pushing for gives enough breathing space for us to do that with integrity and authenticity.
I second so much of what's already been said, and in drawing from Marian's observations and reports of the startling numbers, I think that as we're professionalizing this field of arts and health, that is this group movement of practitioners who are saying we are artists that want to exist at this explicit intersection of making our art for in healthcare settings, in patient care settings, but also towards public health movements. We have to think about what art it is that we're funding, and also think about whose art we're studying. I attended an arts and health research intensive last spring, and I found myself really just struggling with the how should I say this? Struggling with how disconnected the arts and health field in the States is to the global landscape of art making for health, and how it's most people are unconsciously telling health stories and not aware of it. And so even in this time of pause, as theater makers are going virtual and needing to have these testy conversations with unions about what constitutes film and TV, or et cetera, those nuanced questions, my hope is that we would take a pause too and ask ourselves, what stories are we funding? What art making are we producing and investing in? Because similar to that correction that Marian made of untold versus unheard, prior to COVID-19, in the midst of this, I think we're all experiencing this pandemic differently. And I, as a Black woman, and I'm experiencing COVID-19 and that pressure, but also, with the poem we opened up with, in the news and the news headlines and the response of the community, and confusion and misunderstanding as to whether protests should be called riots versus who's in the blame, et cetera. When we take a pause from that and we think about how we're all moving towards healing, we all want to heal from this. Healing looks very different depending on your place in the world. If your desire is to return to normal, that there are individuals within the arts and culture sector across the health landscape that don't want to go back to the normal, because that normal was also a pandemic. It just had a different name, or a different level of attention. So when I think about, how people are pivoting towards COVID-19, I think my hope is that people would pause and question, this artist, Alicia Harris, she wrote a play, I think it's What Goes Up When It Comes Down. And this play is like a ritual, and it responds to both the actual death, but also spiritual Black deaths due to racialized violence. And so the question is, they were supposed to tour multiple more companies across the country, and they can't do that anymore. But Alicia Harris, as playwright, is hosting an event with the Dramatists Guild of America this weekend, where she's going to be doing a virtual healing specifically for Black people. And that's like the pivot that, virtual spaces, there's a crowd of people saying that's not what theater artists can do, but some people are holding on to that. And so for those who have resources, who those have access to that, I think it's shining a light on what's happening in communities to, defy grief with the joy that must be reserved for us in this time, so that stories aren't just of, anti-Blackness or shame or deficit mindset, but also that of the light that comes up. And I think that that's exactly what that poem that we opened up with does.
Yeah, absolutely. What I'm hearing a lot is arts kind of with a capital A as this sort of, official thing that exists in the world, and arts as something that people practice interpersonally all the time and just in their way of being. And it reminds me of Cara talking about her work with the essential workers and having these oral histories, which flip the who we consider to be important enough to record and be able to, have these kinds of things for posterity's sake. And so I'm really provoked by this question of imagination and Claire's idea of, reimagining this space in terms of COVID. But I also want to invite all of you to think about other ways that you've considered imagination, maybe not just in a capital A art space, but in these kind of more granular art practices, and also like desire and joy and pleasure. Where do those sit in a moment like this?
Yeah, can I just go back one question, if that's okay? Because I was really, yeah, because a lot of what Shanae said really resonated with me. So I think when I look at this moment, I'm both encouraged and really concerned when it comes to storytelling and the stories that are shared. Because I think there's increasing interest in, let's say, whether it's essential workers, or it might be an increasing interest in telling the stories of people who are disproportionately affected, and that's largely people of color. And that attention, the spotlight needs to be on those communities and on those issues. But I worry that, as soon as this is done, that this is creating a kind of a narrative that is sort of typical, in my opinion, to sort of how the media oftentimes covers certain communities, which is through the lens of crisis, or through the lens of, either oppression or triumph, which kind of contributes to this whole sort of othering of people. So I don't think it's helpful at all. I mean, I think you have to have those stories, but I think, once the crisis is over, what are you left with? You're left with a large narrative about people, that is this sort of victim narrative that I think is, or a survivor narrative. But I think either one is too oversimplified. We're all human. We have so many different sides to ourselves, and our communities are so rich and complicated. And I don't think that gets reflected in the media in general. And so I worry that, as soon as this passes, we're just going to go right back to a definition of community and a definition of caring, frankly, that doesn't necessarily focus on, neighbors. It focuses on that other community there is hurting. Let's feel badly. Let's give money. Let's give, that kind of thing. let's read up, let's, you know, all that needs to happen. People need to be supported, absolutely, but there's this larger question of, can we shift the culture so that we are seeing each other, you know, as neighbors? And one of the things I like to say is that Everyday Boston, that we believe that strangers are just neighbors you haven't met yet, you know. And if we could I would love to see some of that get in there during this time, and for us to sort of build some practices or ways of looking at things that will sustain us far beyond the pandemic, because I worry that we're just going to snap right back.
Yeah, I think you raise a really important question, which is the relationship between the individual versus the structural in a moment like this. You know, epidemics, what they often do is really, really highlight the fissures in society and the structural inequities that are present. And then when we turn them into maybe like an individual narrative, what happens is we have these stories of success, we have these stories of the victim, but it kind of elides these structural inequities that are producing the need to be a victim or to be a survivor in these moments. And so I think that's
Sorry, just one last little thing on this is that I've noticed that in talking to a lot of journalists, they've sort of went, and I've talked about the Essential People Project, and they've sort of said, oh, where are you finding these essential workers? I'm kind of like, what do you mean, where am I finding them? Like, they're part of my world. Like, I don't understand why that's a question. And to me, that's really concerning, that the segregation that exists in Boston is so deep, and that yeah. That's all I have to say, sorry.
Oh, just going to, this is like in the same part of this conversation, but thinking about imagination and building off of Cara's comments, I'm thinking about a story that, you know, a narrative that was going around on social media, just like with a lot of memes. There were a number of people within the Black community that believed that they weren't going to get COVID-19 because all of the initial stories about it did not tell the story of people of color. And so there were these memes going around, and Black health experts were trying to, you know, put their, you know, brains around, like, how do we offer the counter narrative to this, and how do we just reckon with the reality that that was not true. And now we know it so closely. And there's a public health professional who created this memorial for people to submit the, you know, the names and essentially like an honoring online, a virtual place to memorialize these individuals who lost their lives to COVID-19, specifically Black lives. But, you know, the imagination is then that another person of the Black Caucus was talking about, well, maybe we just need to create other memes that, you know, you tell these stories. And I think humor oftentimes, and I think I'm thinking back to this dark comedy I was a part of, often, you know, it's not for everyone, and it's deeply critiqued, and sometimes people look down on it. But when we look back on history and we look about and we take a look at people from all different backgrounds, how humor or how joy or how happiness or this subversion of thought is tracked, it's helped and it's sustained people's mental health, and even as it's created, like, again, nuance, it's been much needed. So I think when we invite people to imagine what the world can look like beyond COVID-19 or beyond structural racism, you know, we can hear comments like, I'm thinking about our Surgeon General, Jerome, who, you know, he said something like, do it for your abuela, do it for your big mama, etc. And people were deeply offended by that because it was irresponsible, and it was a reflection, even as he identifies himself as a Black man, it was irresponsible because it cemented beliefs that are rooted in these structural systemic, you know, barriers and institutions. So with humor and imagination, people responded. And I think that that's something that I think needs to be protected as we have these conversations and go to the everyday stories of people, so that it's not just, well, racism can't exist if Oprah exists, et cetera. You know, those sorts of things.
So this will be a slightly adjacent response, but I feel that first of all, within COVID, within our isolation and our separateness, I really have the things I've enjoyed the most are the creative expressions that have come out, the collective creative expressions, the ways in which there's been an opportunity for people to experiment with their creativity and their artistic expression. But what it makes me think about is, so the context that we're working in, the arts have been hugely marginalized, and there really isn't a creative economy in the way that there is here. So there isn't, people don't aspire to be an artist. They think, well, that's something I can dabble in, but that can't be the way I live, because this is not going to put food on the table, or, you know, and I think that the school systems have also removed it, and I know that here in the US there's many issues with that too, but I'm going to speak to where we're working, that there isn't creative expression taught. And so what happens in these old styles of learning, like when you break down what is creativity and expression, it's, you know, it's the ability to generate new ideas and to think outside of the box and turn things upside down, look from another perspective and question and just critically analyze. And what you see in a lot of these old structures of education is that they're perpetuating a top-down, patriarchal, very rote approach to education, which kind of strips away that. So it's relearning how to connect people to their creative self. And I think during COVID, I think that what we see in all of our trainings, where we're kind of trying to break down those barriers and reconnect people with their creative selves, that there's joy that comes up, there's humor, there's connection, there's hope, there's vision. So imagination begins in this new way to say, like, look, here we are in the 21st century facing these insane problems. Like, of course we have to be able to think creatively. Of course we have to be able to turn things upside down and look at them another way. And we have to work together. So how do the arts foster that? And so I think we're seeing within the organizations, individuals, communities that we're working with, where, you know, artistic expression is a part of the culture. And so I think there's a lot of healing that's coming together through that, whether it's song or storytelling or any of these formats. But it's remembering to tap into this to imagine the new possibilities. And we're seeing a fair amount of it. It leaves me hopeful. I don't know that we'll ever see the level of investment from a governmental or donor perspective in the arts. I think it's always marginalized, no matter where you are, in what country in the world. And I think this is our greatest challenge, you know, in trying to bring attention to it and to mobilize resources to invest in it, because it can really develop the solutions. It can support the development of the solutions that are going to allow us to build the just society we want. So.
Anybody else want to comment? Marian, I don't want to call you up, but I just want to give you space to make sure.
Sure, I appreciate that. I'm just listening and processing too, as I'm reflecting on the different spaces that all of the wonderful panelists on this call occupy, both geographically and then within sectors and reach as well. And going back to this core question of centering joy, of centering asset-based approaches, of centering hope in our responses, and centering narratives the way that stories authentically want to be told in different spaces, I think is the piece that I just keep focusing on. So in all of these contexts, the recognition that there's rich cultural tradition within all of these spaces. So how do we support the lightest version of that
in a way that is meaningful and impactful. So I think if anything, my pause and reflection is just really, this is challenging me to reconceptualize in the roles that I occupy, what that can look like. And this whole piece about desire and pleasure too, I guess I just want to offer an author that I've been really enjoying her work in this space has been Adrienne Maree Brown and pleasure activism. So I don't know if there are also folks on the call where it's helpful to hear kind of other art that we might be consuming or supporting in this moment that's also giving us life and energy and joy. But her writing certainly has been huge for me during this time.
I can add one recommendation. So Saidiya Hartman has her recent book, which is called Wayward Lives, Beautiful Experiments. And she has this scene in there where there's a young Black girl who's in Philadelphia. She's 14 years old, and she's standing in front of the Wanamaker's, which is the big department store of the time. And she's looking at a dress. And so this is a person who has been in really atrocious social circumstances her whole entire life. And she focuses on the desire of that young girl for the dress and kind of centering that, the beauty and the joy of that kind of interaction being just as vital as her coming from working in, really awful conditions, living in a segregated, dilapidated society filled with, extreme racism. But it's counterposing these kinds of things that I think are really essential also when all we hear is this negative death kind of situation. So I want to just invite you to maybe more specifically, where I guess prior to the pandemic, there were some research was conducted that talked about 5 important areas where public health issues and the arts can intersect. So one was collective trauma, mental health, racism, chronic disease, and social exclusion and isolation. And a lot of you have already talked about these things, but I was just wondering if anybody else wanted to talk specifically about how their work has spoken to these issues and the strategies that you use to think through them.
So what came to mind as we were talking about like pleasure and desire, this is something that I did separate of the Black Caucus, but last summer, my friends who have started a label called Question Culture, they're based in LA. Their aim and mission is, to create music and films, addressing oppression for like a lit world, like that's how they ended it, or the mission. But last summer I was invited to film a music video called Yes Queen, Yes Goddess, YQYG. And it was a microfilm essentially addressing street harassment, but in the very same film that provides like data and stories and this incident, it also celebrates sisterhood. And so they had planned a multi-city tour to, in addition to their art, they always offer some sort of like policy or advocacy campaign. And so they went digital and they hosted an event, an online conversation with Afropunk, and anyone who wanted the resources and these cards, they were, saying that they would ship them out, because something really surprising is that, I don't know if anyone's seen it on their own social medias, is that people are still experiencing street harassment. And it's a tiny thing that that a number of people collectively experience. And it's rooted in so many of the things that I think the research was pointing to. But I've just been so enamored by the ways that they've connected their art to like building community and thinking about how they might share these views, but like build momentum to address something that otherwise is ignored, but it's happening in the midst of this, and it absolutely impacts mental health and well-being.
I suppose I would say that it was wonderful to get recommendations from everyone about books. I think what's been getting myself through this, what's helped me through this, and I think what's helped a lot of people in everyday Boston, is really just the opportunity to connect with people we don't know. I think that's nourishing in a way that really strengthens my mental health, and I think the mental health of a lot of the people who are interested in the work that we're doing. So we've got, we've been working with teenagers in particular who are very withdrawn at this point. There are a lot of concerns about mental health and about disengaging, and connecting them with the elders for these phone conversations, or connecting them by Zoom to essential workers. They're just excited to actually meet somebody new. It's a way of connecting to the world that isn't really on offer when you're sort of sitting in front of a screen, watching a teacher do their very best, to engage. But I think that the opportunity, again, I think there's an electricity that can happen when you meet somebody new that you didn't really expect to connect with at all. And so we're really trying our best to offer that opportunity to as many people as we can. And particularly people who, I think young people are particularly at risk. So our seniors at this point, we also work with a lot of formerly incarcerated people. So they're involved in these interviews as well. And so I do think there's an exciting opportunity here with the work, now that everybody is sort of still trapped in their homes, the ability to make connections more easily through technology. Although I don't know whether you all have found this, but the level of resources are obviously very different from person to person. And so that's been a real challenge. In terms of phones and computers and that kind of thing.
I dropped, sorry, go ahead. Just gonna say, I dropped the list in the chat box in case that's helpful for others as well. I'm just not always super great at auditory processing. So I'm sitting here and thinking about how the work that I've been lucky to be a part of for the last decade really has hit on all of these things in different ways and at different times. And it's been, again, very much like in response to artists and where they are and what they want to talk about. And what I've seen with our work with Arts Connect International, we just had our Arts Equity Summit at the end of April. And that event really, really focused on collective trauma, mental health, racism, and this like question of joy, and this question of counter narrative and production of other ways of knowing and of being. And I'm actually going to share a piece too about my work of life of being outside of my professional title, which is that for the last couple of years, I've been dealing with new chronic pain diagnoses and figuring out for self what that looks like, both as an artist and as an advocate, both patient advocate for self and for others in wider community, and seeing some really cool things that are happening around chronic disease and social isolation, and particularly in relationship to chronic disease during this time. Most of them that I'm thinking of are very much like technology-based and dependent. So I question about the efficacy and other contexts where that might not be as readily available. But this whole piece, Cara, I love just the reminder of like talking to people that you may or may not have relationship to. I'm gonna go socially distance with a 90-year-old Shanae who I adore, who lives about 45 minutes from me tomorrow just because he's an orator. And so I can do that on the phone, but thinking through what are the best ways for us to be in community with one another, and how does community in and of itself support all of those pieces holistically.
I think, we've been working across most of these issues, trauma and mental health, and a lot of the challenges that emerge when you're looking at social exclusion or isolation. I mean, a lot of this is being re-triggered with the COVID, to be, again, isolated or excluded, but maybe they were getting momentum in their life and now it's set back. And maybe there was an outlet and resources for support in an abusive relationship, or maybe there was an opportunity for community to help expand your thinking. So all of these ways in which the mental health can be balanced, but also where trauma isn't re-triggered, and where there's a way to maintain hope. And so I think that there's so many levels of what can support that in terms of the arts, and allowing for that, the processing of these different elements. But what we try to do in all of our cohorts of leaders that we bring together is make sure there is a diverse experience in the room. So we are bringing people with a lot of different experiences that they share amongst each other, and they build collaborative networks. And we're seeing the fruition of that as everyone is now isolated, how they're able through, if it's phone, if it's they do have internet access and are able to do a video chat, but they're connecting and supporting each other across countries, across regions, across all kinds of boundaries that might have separated them because of a being part of a collective and feeling that connection at one point. So we're seeing them being able to perpetuate and support following that, having gone through artistic experiences together, having explored these issues and taken them apart together. There's an understanding and trust that has arisen. And so this is now supporting them in their further isolation in a very hopeful way. And it's inspiring to see that level of resilience. And I think that's what keeps coming out to me as I hear the stories from the girls and the women and the men and the women that we're working with in the environmental field, that they're up against a lot, but that there's a way in which they're able to maintain a sense of hope and possibility. And I think the arts do foster connection and collaboration, and that iterative process of co-creation. It's a mechanism that can perpetuate all these good elements. So this is, it's an exciting thing to be able to share with people and recommend. I mean, even within our own team, which is dispersed in many different countries, that we meet together, we always have to have an opening that's a creative opening and somehow connects us and lets us share where we are and what stage we're at, in order to be able to then delve into the work, because you have to have that human connection. So in the arts, open that space for us as a team.
Can I actually ask you, Claire, a little bit more about that, to elaborate? Because I think oftentimes we get caught up with defining a community in a rigid sort of way and forgetting the porousness of all of us to each other all the time, and the kind of overlap. So I'm curious to know about how, as maybe a specific example, how like different cultural exchanges have been able to work effectively in your work.
Well, so what we try to do is have long-term relationships with groups and community from different communities, and we try to bring together people who are working on a similar issue, but they're coming from very, maybe the disability space, maybe the psychosocial challenge space, maybe it's the it's different regions, for instance. So when we what we've done is we've targeted individuals from those different sectors, and then we bring them together and we build this strong connection within these cohorts, and these cohorts work together over a few years. So the depth, that is a community that is built, and they live in Rwanda, Uganda, South Sudan, Kenya, Tanzania, and did I say Uganda? Anyway, 5 countries. And, an example, one woman working way up in the northern part of Kenya in Turkana, very dry, arid place, facing big issues around early marriage because of poverty. So trying to get girls to stay in school and have access to sexual and reproductive health services is really challenging. They want to be married off quite young. And this woman, just a fierce, incredibly inspiring woman, able to be leading and building a movement there. You know, she needed the tools to do it. So she was part of our 2-year mentor program. She learned a lot of tools from what we taught, but also from the wealth and knowledge of this community in the region. So when she has a question, yeah, she might come to a member of our team in Kenya, but she'll likely go to someone in Rwanda who she's now built this, you know, as part of her community, because there's a shared understanding of exclusion that they've had, or there's a shared understanding of another piece that allows them to brainstorm together and collaborate and say, well, I tried this and it worked, and I was trying to connect with the leadership in this community and I kept hitting walls, and this is what I did. So sharing best practices, and we see it so much. It wasn't the original intention around building these cohorts, but it has been a huge outcome of it, and in both the gender equality and environmental spaces.
I guess I also want to open that up to everybody. I mean, how does solidarity and building this kind of coalition work in your respective areas?
Learning cohorts are such effective supportive models for being able to get to that transformational space and creative ingenuity. So I agree wholeheartedly. We ran an international artist in residency program, and in addition to that, a lot of leadership development programs, and having those cohorts of folks that are learning together is really huge. And I'm currently working with a couple of colleagues in the sector, including Shanae, on a newer project in this moment that is around bringing together small to mid-sized organizations to figure out what their way forward is, and just being in community with each other and the recognition of the importance of getting there, and in particular for this community organizing and centering POC leadership voice and space for that. But the recognition that above anything else, the resource of one another is probably paramount. So I'm glad to hear how effective those learning cohorts have been in other contexts for you as well, Claire.
I just completed my 3rd year of my doctoral program, so I'm inspired by Dr. Marian Taylor Brown. But in a process that I have in my program is to complete like a certifying exam, and in preparation for that, one of my essays was thinking about health promotion ethics, and so I know we've been spending. I'm like thinking to myself right now that it's very easy for me to participate in this conversation as an artist, but in trying to put that other hat back on, I've been thinking about how partnerships can happen from the other side. Like artists are already, as so many of you have said, and organizations have already identified how their work already like aligns with the cross-sector work that you were that we were acknowledging from the Arts and Public Health in America initiative. But in thinking about like health promotion ethics and thinking about how public health professionals, whether they're working within a local department or they're working independently to engage artists, how important it is to like move at the speed of trust, and that trust building often takes place by learning alongside one another. But also there are like a couple of like questions. My advisor, Dr. John Allegrante, he's based in Columbia, and I wanted to pull it up because I thought that some of his questions were super important. So if there are any public health professionals out there, I'm going to try to put my hat back on that way. But when talking about like what makes it like a good society, their paper talks about how this can be summarized as like the moral significance of a community via their shared views, their solidarity, and like their collective action. And they charge, him along with his colleagues charge health professionals to ask themselves, will this benefit everyone, instead of valuing individualism and thinking about how like health promotion would then provide tools for good health, so thinking about like increasing capacity, but then would mitigate disparities and then provide a platform that gives voice to individuals in their communities, honoring the autonomy as citizens, as well as identifying needs in order to advocate for change and fair distributions of benefits. So like all of these things are things that so many of you have already said, and that's why I wanted to pull it up really quickly, but also thinking about how, they're starting to build guides, I think, for how public health professionals might approach artists, ensuring that they pay artists for the work that they do and cultural workers. But that's kind of where my head went with this question of how it's been working, because thus far, I don't have as much experience beyond this one instance where the New York City, so the New York City Department of Mental Health and Hygiene, they were working on a birth justice initiative. So essentially working on how we might advocate or come alongside community defenders, as they identified themselves, to use their stories to communicate the need for community doula programs. And so we led, I think it was about maybe 6 or 7 ethical storytelling workshops. We used applied theater to assist in these workshops with community defenders, midwives, OBGYN professionals, but then also the employees of this health department. But we worked with them independently as consultants, but then essentially brought them together. And I think the support came through practicing what and naming what it is that they wanted to happen. But I think that that's where I'm tying back this article on a good society, because I think that so long as you aren't feeding the story for individuals to share, and you're creating space for them to figure out what story or desire or commitments they would like to be made, you have it so that this birth justice initiative had successfully communicated the desire, established this partnership, and it's still now in its growing form. But it was led by the stories and experiences of people who wanted not only the statistics of, maternal mortality to be what guided them, but also, the beautiful thing that is bringing life into this world. Took me a little moment to get around that way, but thanks for your patience.
So I feel like we're trying to operate on a few different levels. I think much of our work, which is probably why we're not that well known in the city, is really on a one-to-one level. So it's really bringing individual neighbors together, giving them a reason and giving them the tools to actually connect. So, I mean, I sometimes on my days when I feel like we're not, as impactful as other agencies, I like to think back to those those individual relationships. I can tell you that there's one that sticks in my mind, so I'll just share it with you briefly, which is George Powell, who was the first story ambassador with Everyday Boston, and he was 6 months out of prison when he came on board. And he, along with others, I taught them how to interview, right? And then we went to East Boston. He's from Roxbury. Went to East Boston one day and just wandered around looking for people to interview and kind of connect with. Walked into a barber shop, and he was interviewing the barber, but the woman in the barber's chair, her name was Kathy, and she said, "Oh, you're from Roxbury? I got a story about Roxbury." And they just hit it off right there, and they've been really close ever since. And so, they talk like almost every week, and Kathy has said to me that one of the things on her bucket list is for us to go on a road trip to New York, where George now lives, and go to the top of the Empire State Building and, look down on the city, the two of them by their side, by each other's side. And to me, that's a little revolution in a relationship, right? And so I think that to me is the thing that helps sustain and power our movement kind of forward. But I think we also do sort of, if solidarity is the right word, I think we kind of build that through some of the targeted story collecting projects that we do. So we did one on the Cradle to Prison pipeline that we trained, law students alongside formerly incarcerated people to interview other formerly incarcerated people to complement the data that Northeastern had collected on this. So, I think there are different ways to engage, but I really do think it comes down to relationship building and trust building, which is why I haven't taken any shortcuts on that. And that's probably why we're lesser known.
I mean, I think you're attending to the fact that in order for any of this to actually produce something, that there are multiple scales at which engagement has to happen. And to just start at one place, the work can't be done by circumventing all of these other things. I think that there is this kind of slow accretion of trust and mutuality that has to build, and then you reach a point of being able to have a kind of unified collective demand that one can go to policymakers and all that stuff. But that has to be worked through, I think, in the granularity of relationships and, you know, figuring out how to make sure that you can, you know, get to those things before you just accelerate. So it seems like your approach is very effective at not having this, you know, just burning out situation. It's about having more of this kind of sustained engagement. So I want to, we're winding down, and so I want to just end with a few questions for you. One is for all of you, what is the vision? What remains on your action wish list? What would you like to see done in the short term and in the long term in relation to arts and public health?
Okay, I'll start. I'll kick us off. Again, transitioning towards the dissertation work, I'm really stoked about the opportunity that I have to engage in research for public health that prioritize and centers like ethical storytelling, thinking about how artists and cultural workers can think sensitively about how we share stories, how we use them, you know, the reasons why we use particular stories to get towards our goals, and figure out like the facilitators and barriers to those partnerships so that the work can continue to happen all across spheres. But thinking about my work as a health policy research scholar with Robert Wood Johnson Foundation, they created this framework called the culture of health. And I think there's a reason why they use culture in describing that. But one of the action areas they've identified is making health a shared value. And I think this guide of making health a shared value, building off of all the things that Cara just said, and so many others, is thinking about how we might foster that sense of community, and how within the arts and cultural sector, within public health, within the reasons why like the Black Caucus of Health Workers even needs to exist within our professional association. We're trying to merge two fields that historically have continue to marginalize people based off of where they were born, what their racial identity, their ability, their age, the list goes on, whether they were formerly incarcerated, et cetera. So I'm thinking about that sometimes what feels like a tinderbox, and I'm hoping that my dissertation can provide support, provide an invitation for people to think more critically about that, but in like an opportunity aspect as opposed to like a problem.
I look forward to reading that dissertation in advance. And when it comes to the invitation to dream and to envision, I mean, there's 20,000 things that I think could continue to help de-silo some of the sector issues. Something I'm really excited about in this moment is the idea of actually building out a professional program that's very intentional, and like Florida State University has been doing more of this work in advance, kind of within the higher ed spectrum, but thinking very much about how are we professionalizing public health? How are we professionalizing art therapy? How are we professionalizing arts and education? Because even within that space, I think there's a lot of room for improvement to reconceptualize leadership. And through doing that, allowing there to be more support of voice and more support of authentic story and narrative telling across the entire space, and in a way that is hopefully doesn't have as many structural barriers to access to get into. Because I think that's one of the huge pieces too within arts and public health in particular. There's just not necessarily a plethora of organizations, especially in the US, really focused at that nexus point. So how do we create space for those who want to have that entry point and who want to explore it in a more meaningful way. So that's one of the snippets to play with for now.
In our context, there's so much, our dreams are big, like Marian said, there's so many, the bucket list is quite large, and we have a bigger vision than we can accomplish for sure. But there are a couple of areas where I see that there's real opportunity, you know, for there to be greater investment in understanding, first of all, that social change, that shifting social norms around public health, which, you know, that's the whole behavior change component of public health, which is a significant piece, takes time, you know. So what does that mean, you know, and how long does it take, and how do we get our heads around what indicators suggest in terms of whether that warrants funding? So sort of finding a better way to work where there are financial resources, and then where there are resources at the community level of knowledge, skill, ideas, solutions. So how do we bring them together without having to produce these rapid results that it just isn't realistic? So if we want to see it, and I think art, to me, what we have seen has been a way to accelerate some of those trust building elements. We were talking about a little bit earlier, what you can do in a room through artistic process that takes an hour and a half. Suddenly you've broken down all these barriers that let people find each other at the human level. So we feel like it does accelerate that process, but then the layers of having to really penetrate really entrenched social norms that have and the patriarchy, it's just really a long process. So patience, I hope for patience in that, but I also see an opportunity for us where we've been identifying local artists in the communities where we work, and we have been conducting these distance trainings, equipping them with ways to take their art into the social change space, and then having them work with the communities we're working with. And I mean, the results in Ghana were amazing, and it was really exciting to see, and it was around gender equality and environment. I'd love to see us be able to take that into the East African space and in Central and South America to do more of that. And we even have some dreams of being able to bring it to the US. So that it would be, I mean, because we've tried and tested these methodologies so much and they work. So how can we replicate? How can we share more? How can we collaborate more to be able to increase the reach of that? Anyway, very excited to have had this rich opening and conversation.
Yeah, I think in the context of our work, I'm hopeful that this time where we've been put on pause will lead to us really thinking more thoughtfully, maybe, around how we can sort of connect across these dividing lines. I mean, our mission really is to make Boston the most connected city in America, which, you know, some people inside and outside of Boston would laugh at if I sort of say that, because, you know, Boston has a certain reputation. I think we've come a long way, but I think we've got a long way to go. Wouldn't it be nice if we came out of this with some real progress on that front? I think in the short term, goodness, I would love it if people actually, you know, looked at and watched and listened to the stories that your neighbors have collected, which you can find on our website. But, you know, it's not just the essential workers. And somebody did an interview of Abner Benia at, he's a mail carrier in Roslindale. But in fact, there's also a story on our site somebody else collected where he talks about how much he loves to travel. And he goes like a drop of a hat internationally and travels with his friend who he met through an antique store and whatever. I mean, he's got a whole other life beyond his, you know, operating during the pandemic. So, you know, my hope is that people also, you know, be able to listen to your neighbor, you know, if not reach out, if not have the inspiration to reach out to strangers, to at least read their stories and learn from them, because we all can learn from each other, I really believe. Cliche as that sounds. Thank you for including me, and thank you all of you for your tremendous work. Appreciate it.
Thank you for letting me facilitate this discussion. I will turn it over to Erica now.
Wow. Yeah, just wow. I am just blown away with this group of people. I I just was listening to your kind of wrapping up comments and just thinking I would like to continue a conversation with maybe all of you in a real space sometime soon, or in the not too distant future. Yeah, really wonderful to get to listen. Thank you so much, Eram, for your facilitation. Thank you, everybody, all the panelists for participating. Thank you to everyone who joined us today. And I'm just, there's so much here to continue. There's so much conversation to continue, and I can't wait to listen back to the recorded version of this and see kind of what can we take from this conversation, because there's so much. And I was really taken with the fact that there was a lot of conversation about things like imagination and joy within this conversation today, and great reminders. So thank you all. And as I mentioned before, we will be launching a number of virtual events over the coming months for members, donors, and the general public. So be on the lookout for notifications of these events on social media and in your inboxes. And if you're not already a member of Revolutionary Spaces, or you'd like to support our work, you can donate anytime at revolutionaryspaces.org. And you can follow us on social media, Revolutionary Spaces on Facebook, and at Rev Spaces on Twitter and Instagram. Thank you all again. We hope to see you soon, and be safe. Have a good night.